Good afternoon, everyone. Thank you, Dr. Lawson, for joining us our session. So, as we wait for the participants to join, I think it is better that we can just going ahead with the meeting. And since it is a recorded session of the meeting, so the same recorded version would be shared to all the attendees on the registrations who are joining late or who missed to join the session. So, over to you, Dr. Lawson. Thank you.
Okay, sorry for that delay. I think there was a bit of a glitch. I hope you're all able to see my screen. I'm Brigadier General Dr. Lawson Mapuka. I'm the Chief Academic Officer and Dean of the School of Public Health. So in case of just bring everyone to speed, today we are looking at the Bachelors in Public Health. And this will be an overview of my discussion with you over the Bachelors of Public Health. We'll look at public health as a science and an art, the purposes for public health, the core components and subfields, degrees in public health. Then we shall also briefly look at the postgraduate programs that are offered in public health. Then we'll look at course delivery and then the careers in public health. So what do you understand by public health? Public health is both an art and science. Basically, it's a science and art of preventing disease, importantly, prolonging life and promoting physical health. And this is done through organized community efforts for sanitation of the environment, control of community infections, education to individuals in the principles of personal hygiene. The organization of public health is basically hinged on provision of medical and nursing services. There's early diagnosis, preventive treatment, and development of social machinery, which ensures that every individual in the community has a standard of living adequate for the maintenance of life. And that's a definition that Winslow gives us, and this dates back as 1920. So what's the purpose of public health? The purpose of public health is twofold. You have interventions to prevent and mitigate diseases, injuries, and other health conditions. However, the overall goal is to improve the health of a population and increase life expectancy as indicated in the definition. What are the core components of public health and indeed the subfields? As I indicated, public health is an art and a science. So of the basic public health sciences, we have epidemiology, biostatistics, social sciences, and scientific methods and research. These are the basic sciences and backbone of the field of public health. It is important that we go through epidemiology so that we understand the determinants and frequency of disease. Biostatistics helps us interpret results. Social sciences helps us understand how human beings understand health and the causes of ill health. And of course, you cannot provide preventive measures, curative measures, without conducting research. Of the subfields which are supported by the basic sciences, you have health policy, health services management, health economics, and public health policy. These are very core to ensuring that in any country or in a community, you run efficient and effective health services, efficient and effective interventions in as far as prevention of diseases is concerned, or indeed health promotion. So what is the application part of public health? You have global health, which looks at health for all at a global level and different interventions that have been put in place. We are talking of SDGs in health 2030, disaster management, occupational health, looking at safety at work environments, environmental health. Here we look at both physical and built environment. Physical and built environment are very important in as far as health promotion and prevention of diseases is concerned. Maternal and child health, sexual and reproductive health, health promotion, health education, community health, behavioral science, mental health, and indeed health politics. So this is a multidisciplinary field that requires engagement of different professions to get to the desired goal of preventing disease, health promotion, prolonging life, and making sure that individuals lead a healthy life. What are the degrees that are offered in public health? So a number of schools offer a variety of degrees that lead to an individual being a public health practitioner or officer indeed. In the case of school leavers and diploma holders, the entry into the public health practice is the Bachelor of Public Health, which we'll go into detail later, and offered by Texila American University on on-campus basis and also distant blended programs. So apart from the basic qualification that you can get in public health, there are two major postgraduate degrees that you aspire to get after you get your bachelor's in public health. There's the Master of Public Health or the Master of Science in Public Health. Texila American University, Zambia offers the Master of Public Health, unlike the Master of Science in Public Health. Then in the field of public health, you will not end at the level of the master's program. You go into doctoral studies, and indeed, at that level, you would venture into studying as a doctor of public health, or indeed as a doctor of philosophy in public health. So, It's important for us to understand the difference between the Masters in Public Health and the prerequisite for us to go into a Masters in Public Health is a Bachelor's in Public Health. The prerequisite for us to get into the Master of Science in Public Health is a Bachelor's in Public Health. And the two masters are prerequisites to getting into the Doctor of Public Health, or indeed Doctor of Philosophy in Public Health. So the Master of Public Health is a practical master's degree. It trains you to go and work in the field. It trains you to become a manager. In a health institution, or indeed in NGOs that deal with different interventions in as far as public health is concerned. Or you'll be sitting in a government office advising or developing different interventions, or advising indeed on what interventions can best be used in the practice in order to control disease, promote health, and indeed prevent disease, which leads to health well-being of an individual. So the Master's in Public Health is a professional degree, while the PhD is an academic degree. An academic degree, you graduate to be a researcher, to be a scientist, or indeed an academician to teach in a university like this one. So you can see where you're coming from. Your aim as you move from Bachelor of Public Health is to attain the highest qualification in the field, which is a PhD. So the sky is the limit. And you would not make a mistake to have chosen to get into the field of public health, as opportunities are quite wide. So what are the entry qualifications for the bachelor's in public health? Basically, you need to have 5 credits or better. English and mathematics are a must. For diploma holders, depending on the credits that you have acquired, you may enter at second year level or indeed third year. I think the Texila American University program is allowing entry at third year level, meaning that the DBLP program, the distant blended program, when one comes in with a diploma, will only cover the last 2 years of the program. How is the program administered? We have the on-campus program, which is a 4 years program with a semester pattern. And then we have the DBLP program, distant blended learning programs, which is a 2-year program covering the last 2 years in the 4-year program. And this is trimester based. When you talk of a trimester, we are talking of a period of 16 weeks. And it's in trimester, the students take 2 courses. This makes them have a deep understanding of the courses that they are taking. And it gives them a bit of latitude, since most of these individuals will be in employment. So there's a bit of flexibility. and it gives them more time to understand the courses that they are taking. At the end of the day, they come up as A1 graduates and indeed better practitioners in the field of public health. The university is a state-of-the-art university, tier 1 university, with highly trained faculty. We have faculty with more than 30 years experience in public health, both medical doctors and non-medical doctors, which gives credibility to the program. For the distance blended learning program, there's self-learning and of course contact classes which are conducted on Saturdays from 12:30 to 13:30. Then it's very important that those who are on the DBLP program attend class. And what is desirable is at least to have a contact class attendance of more than 75%. And from the research that has been conducted in education circles in the health field, attendance actually does promote higher level learning. And attendance does promote retention, which later is transferred into skill. So attendance applies both to lectures and also forum discussions, which I'll come and explain later. How is the Bachelor of Public Health program delivered? As I indicated, over the weekends, we have contact classes. Your lecturers will be using aids to conduct these classes. Usually they'll use PowerPoint slides. Then on the learning management system, the LMS platform, the university is very sophisticated and very advanced in as far as e-learning is concerned. The learning management system is a system that is user-friendly and can be interrogated. And it's a depository for both student administration and student academics. So on the academics part, the slides are deposited in LMS or uploaded in LMS. And the students who have access to these slides, the time that the lecturer will be taking a lecture, they'll be very familiar with what the lecturer is talking about, and they'll be able to interact and engage the lecturer during the lecture period. Then we do upload reading capsules to guide with salient points to guide the students in their learning or search of materials in other resources. The same learning management system actually does link you to online libraries and other sites that may have videos and other learning aids, audio-visual aids that will help you understanding the course content. We do not let our students be on their own. We do not let our students be on their own. So we have faculty-student interactions. Students book for a slot when they were not clear about course content. It may be in epidemiology, biostatistics, communicable diseases, environmental health. The student will interact with the lecturer or the faculty and clear those gray areas. In terms of assessment, when each unit is completed, because the course structure is that you have modules and the modules have units. There's unit 1 to unit 4. So when each unit is completed, I mean unit 1 to unit 3. So when each unit is completed, after the completion of each unit, there are MCQs, about 5 MCQ questions. To be specific, there are 5 MCQ questions which the student answers and then proceeds to the next unit. Then we have included case studies that the students will interrogate and come up with a write-up. Then we also upload forum discussion questions, which requires that each student does participate in the forum discussion. A question will be dropped on the forum. Maybe we can look at issues of COVID. Why do you think that students at Texila, or indeed in Lusaka, Swaziland, Joburg, Namibia, or indeed West Africa, are skeptical about getting the COVID vaccine? So here, what will be required is to put your input there. From the knowledge that you have acquired, you analyze and give your opinion. Then you'll be graded accordingly. So the MCQs, case studies, forum discussion questions, these form part of your internal assessment or the continuous assessment. Then at the end of a semester or a trimester, you have the external assessment. That's the external exam or the summative exam. And usually the summative exam comes in form of multiple choice questions. So what are the career opportunities for you in public health at bachelor's degree level? At bachelor's degree level, the opportunities in public health at bachelor's degree level are that you end up as a public health officer. You may be a research assistant. You may be a healthcare administrator, public health nurse, public health project manager, or health informatics specialist, or indeed healthcare advisor. But there is need for us to prepare for postgraduate. Public health bachelor's degree is not a dead-end degree. It has progression, and that's what gives us the confidence to have this as one of the core programs in the university, because it's a progressive field which ends up to the highest in terms of academic qualifications. And of course, depending on how you perform, if you choose to go in academia, you may end up as a professor in public health. So what happens when you go further and pursue your master's degree or PhD? When you pursue your master's or indeed PhD, you will become, depending on the field that you take or your areas of interest, You can be an epidemiologist, biostatistician, a researcher versus research assistant. You can see that there's progress in terms of career development. When you're at postgraduate level, you'll be a researcher. Then again, you can be a healthcare administrator, public health nurse, or indeed public health project manager, health informatics specialist, or healthcare consultant. When you look at the NGO world, the WHO, in all the fields in health, the requirement is that the individual to be employed as a background of public health. Why? Because they understand the management of programs or health programs. They also understand how to adduce evidence by conducting research, and they can also interpret the results, which makes that profession. You may be a nurse, biomedical scientist, environmental scientist, medical doctor. You become a well-rounded profession, such that even when you go into a conference, there's a paper presentation. It's very easy for you to understand what's going on and critique that paper. It's very easy for you to understand what the researchers who are presenting the paper are talking about. They'll be talking about p-values, confidence intervals, tests of significance. If you have never been in a class of public health, you are just a core specialist in medicine, nursing, biomedical science, environmental science, it's very difficult for you to understand some of the aspects that I was talking about. And that's what makes a must do. That's what makes public health a must do degree for those who are coming from school and diploma holders, bachelors, excelling through to the highest level, that is attaining a PhD, and later in academics, becoming a professor of public health. So if you're aspiring to be a public health specialist, you have not made a mistake. You've made the right choice. And I hope the insight that I've given you will help you to make decisions. Thank you very much for listening to my presentation. May the good Lord bless all of you.
Thank you, Dr. Lawson, for such an inspiring presentation. And I'm sure that the audience might know why they have to choose Texila American University to do Bachelor of Public Health program. So participants and the registered users, so this recorded conversation will be sent to all the registered participants via email. So when you're having a time, you can always refer this and you can always choose Texila to do Bachelor's in Public Health program. So thank you, Dr. Lawson, for your valuable time and an inspiring presentation for the prospects who wish to do a Bachelor's of Public Health program with Texila. Thank you. Have a great and good afternoon.